Hello, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. Every Monday and Friday, 1 p.m. Eastern Time, we are hosting Facebook Live, bringing experts or parents from all over Canada to talk about what's happening right now in the pandemic and also to address a lot of issues related to prematurity. And today we're going to talk about certainly a concern for parents of premature babies. We're going to talk about reflux. And I have here with me Tammy Sherrow. And Tammy, during her 35 years as a nurse, Tammy has focused on the premature population, both in the NICU and in the community, as a staff nurse, educator, manager, and researcher. Tammy works with a specialized neonatal team following very low birth weight preemies post-discharge and knows firsthand the challenge they can face, especially during the first year. She's the co-author of Preemie Care, a guide to navigating the first year with your premature baby, which was published in April 2019. She's currently an associate professor at the School of Nursing and Midwifery at Mount Royal University in Calgary, Alberta. Welcome and thank you for joining us here today, Tammy.
Thank you for having me.
This is such an important talk for all parents, I believe. And my first question is, what is reflux? And we talk about that so much, and you see parents asking questions in our private parents group on Facebook. And why is this more common in preemies?
All right, so gastroesophageal reflux is really the movement of stomach contents from the stomach back up the esophagus into the throat, sort of the oral pharynx, and then it may come out as, spit up or vomit. There's a little sphincter between the stomach and the esophagus called the lower esophageal sphincter. And due to the immaturity in the preemie of the digestive system, this sphincter just doesn't work as it typically does, and in a term baby or an older baby. And so that stomach contents is just like free to flow back up into the mouth. So definitely a common problem we see in prematurity. It can start in the NICU, but it often starts at home once babies are taking more volume and becoming more active. So it often happens during activity, right? Squirming, coughing, grunting, sneezing, straining for a bowel movement, that type of thing.
So, and obviously I read on your book, which is I wish I had this book when my son was in the NICU and coming home the first year. And in your book, you talk about these different types of reflux, which I found very interesting because my son was never spit up, and then I read about the silence reflux, and there are different kinds. Can you please let us know what are these different kinds so parents can actually be able to identify if the babies are having a reflux or not?
Okay, good. So we often think of sort of the simplest form of reflux is something we call simple in our book. And it's where the baby might have spit ups. They could be of moderate to even large volume. They could be projectile. But they're happy babies. They're eating well, they're sleeping well, they're growing well. We often term these babies the happy spitters, or sometimes the laundry babies, because there's a lot of mopping up of spit ups. And but typically these babies are kind of unfazed by their reflux. Then the one you mentioned, silent reflux, sometimes that's called invisible reflux, where there's still regurgitation of contents from the stomach up the esophagus, but often it doesn't come out as vomit, but the baby can still experience the irritation of the acidic contents of the stomach. They might present with dry swallows where it looks like they're trying to swallow something back down. They might have sour milk breath. So those babies typically, they might have growth issues, but they might not because they're not actually refluxing volumes of milk, but they can still have the pain associated with that irritation to the esophagus. So that's sometimes the baby that's a little bit harder to diagnose, right? And to say, definitely this is reflux. And then the third type, what we would call severe reflux, and often this is termed gastroesophageal reflux disease or GERD. These babies will have issues with growth, weight gain, feeding, behavior, sleep. They don't tend to sleep as well. And those are the babies that often, really might need some significant sort of therapy to be able to help them cope with that and to kind of get their reflux under control.
But we also talk about some conservative or first line strategies to address reflux before we go into other strategies or medication. So what are just some strategies that parents can do at home there to address that issue?
Yeah, and that's a really good question, because there are lots of things we can try just in our home setting and kind of monitor our baby's response and sort of see, are things getting better, and then kind of reassess as you go. So the number one is really breast milk is best. If you can provide breast milk, it is more easily digested, easier on the digestive system, and usually digested a little quicker. So it's ideal if you have the opportunity to provide your baby with breast milk, or even fortified breast milk. Feeding at a moderate pace. So a lot of babies can be really quick feeders and do a lot of gulping and whatnot during their feeds. And so we want to be able to pace our babies, and a lot of NICU parents will have become familiar with this term, where we try and kind of pace the speed at which our baby is feeding. And by slowing that, then we have less gulping, less taking in of air. Often that can help with reflux. Smaller, more frequent feedings. So not overfeeding your baby. That's probably one of the top first tries. Because a lot of times it's just like us, after we have a large meal, we might tend to have some reflux or feel really full or uncomfortable. And so that works for our babies too. So spreading those smaller, more frequent feeds throughout the day. Holding your baby upright. So I have my little baby here. A lot of times in the NICU, we do sideline feeding. So with a baby with reflux, rather than being flat, we might just still be able to feed them sideline, but bring our leg up so they're a little more on an incline, or move your baby to a little bit more upright feeding during the feeding process, if they can handle that and they're not flooding or having spilling in this position. And then burping your baby frequently throughout the feed. And a lot of times our traditional burping position is this, and you can see the sort of compression on the stomach. That's going to increase our reflux. So trying to keep that body really nice and upright, and burping like this in this position, keeping the body straight, or over your shoulder, where you can still kind of keep an eye on your baby, but once again, preventing that gastric compression and keeping the body nice and straight. Other things is to avoid the car seat at all possible. That really puts your baby into that, sort of gastric compression position. So if you are heading out and your baby is hungry, maybe giving them just half the feed before and then finishing it up on the other end. Certainly avoiding the car seat as a place where your baby hangs out. It's only really for travel. This is a really interesting one, because when we wrote our book, we thought, how do we describe this? And we described it as preventing your baby from falling into crooked positions. So your baby might be in a bouncy seat or a stroller, and a lot of times they can get into crooked positions. And once again, just causes that gastric compression. So we often recommend providing a little bit of tube receiving blankets or towel rolls on the side, trying to keep your baby in nice alignment and preventing that compression. With the car seat, though, we never put towels and things inside the straps, only on the outside. But in a bouncy chair or a stroller or a swing, you could certainly use those. A couple last points about sleeping position. Some babies have less reflux when they're prone. Never put your baby prone unless they're supervised and you're there observing them. Some babies do well, say, maybe you have a breastfeeding pillow and you can put your baby prone with their arms over the breastfeeding pillow, or up on your chest if you have time. Those are all great positions. But if they go to sleep, they should be on their back from a sudden infant death risk prevention. So we still say even babies with reflux should go to sleep on their back. And the last one is the diaper change. All right. So try and change your baby's diaper before you feed or halfway. If you have to change it, try to think about rolling your baby to the side versus lifting the legs up, because once again, that may stimulate reflux. So those are probably the top conservative strategies. Other things you can think about is being sure you're mixing your fortified breast milk or your formula correctly. If you were, say, not adding enough breast milk or water to it and the formula was very dense, that can cause increased reflux. Secondhand smoke makes baby cough a little bit more reflux. If your baby's getting sick, maybe your baby's getting a cold and they're stuffy or they're coughing, that could cause a little bit of reflux. So those are some of the key things to think about and to try before, maybe going even to see a healthcare professional. All those things you could try at home.
So there are a few questions before we move on to that, because parents ask us questions and I always monitor the questions here. First of all, when you baby back to sleep, certainly for a safe sleep, but flat mattress.
Yes. Flat.
There's no elevation.
There is no elevation. And it's interesting because I've been in nursing a long time, and I remember the days when we used to elevate the head of the bed for babies with reflux and things like that. But our guidelines from the Canadian Pediatric Society, American Pediatric Society, is the safest position is still to put your baby flat on their back on a flat mattress. One thing I was going to mention, that this notion of increasing the head of the bed, those are things that you need to discuss with your healthcare professional, your physician, and they might do a risk assessment on whether that's a possibility, but that's certainly something that we don't recommend.
Okay, and the next question is, you talk about the flow of the feeding and go slower. So that seems to be more obvious to do when you're bottle feeding the baby, but how about when the baby's on the breast?
Okay, good question. So you still could pace your baby by unlatching them and giving them a little break. Often they might do some panting and kind of catch their breath. And then you really wait for the baby to cue, open their mouth and come toward the breast to be ready again. Especially for women that have fast flow, let down, that sort of thing. So you can still pace the baby at the breast. And that's one of the things in our book, probably the most extensive chapter is on feeding. And we talk a lot about pacing with the breast and the bottle. So, yeah.
That's so great, Tammy, like great tips. And what happens if those strategies don't work? Mom and dad tried everything, try all those tips, and baby still not comfortable.
Yeah. So that's really the time to, seek out some advice from your healthcare professional, typically your pediatrician or your doctor that's caring for your baby. And some of the things that they will consider at that point is maybe maybe there's a possibility of a formula change. Maybe there's something about that specific formula that your baby isn't tolerating. If you're breastfeeding, that's not an issue, but a lot of times we fortify breast milk with different types of formula. I would say for the low birth weight and very low birth weight population, very common that we might be doing a combo of all three, right? Some breastfeeding, some fortified breast milk, some formula. So maybe there's a possibility of a formula change, something that's more easily digested for your baby. I talked a little bit about the caloric density. So, you know, how concentrated are we making the formula? This is specific to fortified breast milk or straight formula. You know, is there some shift there? I'm sure there's some pretty experienced parents here. So say your baby's on 27 kilocalories per ounce. Maybe we adjust it down to 24. Your baby's still going to gain weight because they're not going to be refluxing as much. So sometimes there's a little bit of wiggle room in the density and the caloric delivery that can help some babies. It's a little bit of an experiment. Our babies will tell us if it's working. The notion of the alternate sleep position, which is always a conversation with your doctor. And then lastly, two things that they might consider is probiotics. We've had some good success with probiotics in helping to manage reflux, or reflux medication. So there are medications to treat reflux.
So probiotics, this is such a big thing, because I remember when my son came off the ICU and I started on probiotics right away. Are there probiotics that are specific for preemies, or they can ask their healthcare professionals what is the best one for their babies? Because we have this question in our group all the time, talk about different kinds of probiotics. If there is something that is not recommended for preemies, or this is something obviously by case.
I definitely would get the recommendation from the physician. You know, BioGaia is one that's used commonly in the NICU, and parents can buy that at home. You know, there's special dosages and how to care for it. It needs to be refrigerated, things like that. Can be a little bit pricey, but with the premature gut and the immaturity of the digestive system, we're seeing some positive things around probiotics, even above and beyond reflux. So certainly, you know, as you advocate for your baby, maybe that's something you want to propose when you go and see your healthcare professional.
And then certainly the medication is discussed with the doctor, which is the best medication for the babies, and a right schedule.
Yeah. And the one thing about reflux medication is there's several types. Some just buffer the acidity of the gastrointestinal contents. Some decrease production of the acid, and some impact motility, sort of getting food moving through the system faster. And so, you know, you might start with one medication. Then, you know, within 2 to 3 weeks, you should see it working. If it's not working and you're not seeing improvement, that's where you want to go back to your healthcare professional and reassess, because maybe they'll move to a different type of medication. And then obviously they'll be aiming to wean your baby off that as, you know, reflux improves. But none of the medications stop the reflux. It's more about managing the acidity or the motility.
And this is so important.
Yeah.
So now I want you to talk about the cow's milk protein allergies, because we talk about the cow's milk all the time, or even when to introduce, and we also hear all the time that can be associated to reflux.
Yes. Yeah, exactly. So cow's milk protein allergy is, it's not necessarily more common in preemies, but certainly it does cause reflux-like symptoms. And the stats are about 25% of babies with reflux is due to cow's milk protein. So it's fairly prevalent. What happens is your baby's immune system reacts to the protein that's found in cow's milk. And that could come through breast milk. because you're consuming cow's milk protein, the mom. It could come through formula, or it can be in some fortifiers as well. So your baby's system reacts to that. Some of the common signs and symptoms are diarrhea. You might see some blood in the stool, like even flecks of a frank blood. You might see something called atopic dermatitis, where they might have some red, irritated, itchy patches on their skin, and a runny nose is another sign. So I worked with a little girl that had really significant reflux, and we discovered that she likely had a cow's milk protein allergy. How we kind of rule that out is a decision to do typically a 2-week trial eliminating cow's milk protein. So if the baby was on formula, we moved to a hypoallergenic formula. Lots of different brands out there. I mean, if you're in Canada, Nutramigen is a common choice. And if they're breastfeeding or having some fortified breast milk, then we once again would fortify with the sort of hypoallergenic formula, and mom goes on a cow's milk protein-free diet. So there's lots of information about what that diet looks like, and certainly, you know, a public health nurse, healthcare professional could provide that. But 2-week trial of that, usually a baby with cow's milk protein allergy will see pretty dramatic improvements.
So Tammy, there's no test for it. Basically, the test is to try at home without, to see what happens.
Yeah, exactly. It's really a trial with you know, removing cow's milk protein from the diet and looking for improvement in the symptoms. The one thing I would say is that sometimes babies that have been experiencing reflux for some time can have a bit of oral aversion, or they begin to associate the pain with reflux with feeding, and they might develop some, you know, feeding issues, not wanting to feed, those types of things. And so, you know, if you discover that, sometimes you know, you've gone down the path of trying everything, and that can happen. And I did want to include that, because babies can get a little hardwired around the negative pain associated with feeding and feeding. So the reflux might improve, but sometimes that unhardwiring can take a little bit longer for the babies to begin to realize that feeding can be a really pleasant experience again. So that's where often you might be working with an occupational therapist by that point in time, or something like that. So important for parents to notice those aversive behaviors, though, because that really means that baby needs some help.
Oh my God, that is so important, Tammy, to bring that up, because I think feeding is such a stress. It can be a very stressful time for parents, right? Because all we want to do is to feed the baby, make sure the baby is growing, and then we bump into those issues that it can be very stressful for moms and the caregivers and the dads. That is, the whole moment becomes not the most pleasant moment. So, but I want to ask you, any advice for parenting a preemie or a baby with reflux? Because you mentioned in your book a lot of different strategies and advice that parents can actually do, how to become that parents that, okay, that's not make that such a stressful time, and make it pleasant for all of us, for the whole family.
Yeah. It can be very stressful parenting a baby with reflux, especially one that's experiencing pain and discomfort. And, you know, you're right. We've had preemies. We just want them to grow and thrive, and feeding is such an amazing experience for parents, right? And so now that can be sort of set up to be a negative experience, and you're, you know, fighting to get every little drop of that, you know, gold milk, breast milk, or expensive preterm formula into your baby, only to have them, throw it up on the carpet or the couch or the floor. And so it can be very stressful. I've witnessed that in parents. I remember one mom saying to me, I went online and was, chatting with other preemie moms, and I was glad to hear that other moms cry when they feed their babies. It can be very stressful. So some of the things that we really try and encourage parents to do is to get help, like to have help, work as a team with your partner. If you can get help with other things around your house, support from, friends and family and loved ones, and to take that break, because it can be very exhausting and stressful. And some of the things that our parents told us when we were writing our book, because we did work with a group of 10 parents, is they suggested keeping a log of the reflux. Because sometimes, you've tried some of the conservative strategies at home. Now it's time to go see your healthcare professional. You show up and you say, my baby has reflux. Well, what kind of reflux? How much reflux? How often? And so parents found if they kind of kept a little log of that, then when they went to see their healthcare professional, they were so much more prepared. The doctor could understand the severity or significance of it, and things usually went a lot better. Educating yourself. So parents that are watching this or reading about reflux, the signs and symptoms, the conservative strategies, parenting a baby with reflux, those are all ways you can educate yourself. Advocating for your baby. So, historically, a lot of times the first choice was always to move to medication, but advocate for your baby. Is medication the first best step? Maybe there's some other things you can try. Don't be afraid to get a second opinion if you feel that things aren't going the way that you would hope. A lot of parents struggle with making that final decision to move to medication. We've heard that from parents. I'm going to say you should get a CPR training course, and that's now starting to be a little more standard, kind of as you exit the NICU, but some babies with reflux will have choking episodes. They could turn off color, and you want to be able to manage that at home and feel confident that, you can manage that and care for your baby until, say, emergency help arrives. And the last major word from parents was that taking a break thing, getting support. It's not a forever thing. Most babies outgrow reflux as they grow. Typically by 9 months, you should start to see it improving, and often by a year, most babies have outgrown it. So that's good to know that it's not a forever thing, right?
There is light at the end of the tunnel.
Yes, exactly.
So Tammy, just to finalize, any final thoughts for the parents watching us at home?
I would say, my biggest things that I would hope for you to take away is sort of knowing the signs and symptoms of reflux over and above the simple reflux. So your baby has reflux. Being able to pick up on some of those signs and symptoms of silent reflux or more severe reflux. You had talked about our book, and we have a beautiful table in here that breaks down the signs and symptoms that parents should be looking for. So things like the dry swallows, the gagging, the sour milk breath, a little bit of the food aversion. Those are things that if you're seeing, you need to see your healthcare professional. Knowing that there are lots of things you can try at home before that, though, and I really encourage parents to try those strategies first, and then keep in contact with your healthcare professional regularly. So your baby goes on reflux medications. You know that you should be seeing some results in 2 to 3 weeks. If you're not, maybe it's time to go back for a revisit. Maybe they would readjust the medication, try a different medication, something like that. Babies grow, they might need their dose adjusted over time. So keeping close contact with your healthcare professional is important.
Absolutely. And even during the pandemic, when parents might be afraid of going to doctor's office, there is a lot of online consultation with the physicians and nurse practitioners that families can find their local resource in their communities, or call your doctor and see what are the possibilities in your city.
Yes, exactly. And I heard from parents that they were who did go to see their physician or went, say, for vaccinations and stuff, how what a great job they were doing at keeping things clean and sterile, and making sure that it was a safe environment for babies to, to come to. So
Absolutely.
it's reassuring.
Absolutely. And Tammy, your website, premiecare.ca, has some other tips for parents who wants to check it out. And there's a lot of information, good information on the Preemie Care website.
Yeah. We have under resources, we have a number of great links to very credible, reliable resources that we previewed. And then we have a 3 slideshow series, and one of them is on reflux. So, if you want to revisit any of this, a lot of this information is covered there as well. So check it out.
That's wonderful. Tammy, thank you so much for your time, for sharing your knowledge and expertise, and the beautiful book that I think this is such an amazing work that you and Karen did for all the families in Canada. So thank you.
Thank you for having me. It was an honor.
Thank you. And everyone, thank you so much for joining us here today. I'll be back on Friday, and Friday we're going to talk about preventing preterm birth with Dr. Sarah McDonald from McMaster. And on Wednesday, 1 p.m. Eastern Time, Kate Robson, who's a psychotherapist and also mother of 2 premature babies, is hosting real-time peer support groups. And you can access her group by joining the Canadian Preemie Parent Support Network, which is our private Facebook group. Thank you so much, and I see you again. Bye for now.
Bye.